Record. We're going to talk about Crohn's. There's a couple other things I want to just talk through a little bit today. Give me a second here. If you want to hop on, I am sharing the link. Yeah, you can just click in and get on the webinar if you want, or you can stay in the Mentorship and Mastery Group live stream. So I'm going to wait until I see some people hopping on. Oh, okay, I see you guys. I see some viewers. So give me a message. Hi, Kathy. Yep, can you hear me okay? I'm making sure. Oh my goodness, it's been one of those days. My eyes are puffy. I've had a long couple of days. Hi, Anita. Thank you so much, you guys, for your messages about my little dog. It was a very trying couple of weeks with him, but anyway, he's at rest and he's at peace now. I dropped him off for cremation this morning. But I appreciate your support. It means a lot. Trust me, when you feel like you are going through something, really hard that you don't think people understand because it's a dog. If you know me at all, like, animals are like my children. So it meant everything to get those messages and just hear words of encouragement and support yesterday. So I appreciate it. So let's talk. We're not going to be on too long today, but I want to talk about diabetes, and I want to talk about Crohn's. And the first thing, we're going to talk about Crohn's first, because actually it kind of came into my head last night that I also wanted to talk about the difference between ulcerative colitis and Crohn's, because they're often confused. People do confuse them. And my vet actually was she started out as a vet. She helped me with one of my other animals that had to be put down, is how we kind of started to become friends. And then I found out she had ulcerative colitis, and we just kind of traded services where she helped me with my animals and I helped her with her health. Well, that was several years ago. Gosh, I think it's been 4 years now since she helped me with my cat. And I helped her with her ulcerative colitis, and she's had 3 clean scopes since we started working together. No more ulcers on her colon, no more relapses, no more problems. She's had some health conditions come up here and there that we've worked through. But overall, I think it's important that people understand the big difference between the two diseases. So I'm gonna tell you kind of what they are and walk through them just a little bit, because I've worked with people with Crohn's. I've worked with people with ulcerative colitis in addition to the vet, and my friend, the vet. And I think that a lot of people possibly, again, then we have celiac too. And we're not gonna talk about celiac today. That's related to gluten and all of that. But I wanna make sure everybody understands the vast scope of irritable bowel disease and irritable bowel syndrome and problems that are out there. And so the difference between the two, let's cover Crohn's real quick. Crohn's disease can develop anywhere in the GI tract, from the mouth to the anus. The ulcerative colitis, actually, let's crisscross, because I have a chart in front of me that helps me to tell you the difference. Ulcerative colitis is limited to the large intestine, the colon, and the rectum, which is one of the reasons why they have, the bloody stool can be indicative of ulcers. Crohn's disease most commonly occurs at the end of the small intestine. Ulcerative colitis occurs in the rectum and colon, involving a part or the entire colon. Crohn's disease may appear in patches through the intestine. Ulcerative colitis has a continuous pattern. Crohn's disease may extend through the entire thickness of the bowel wall, and ulcerative colitis inflammation occurs on the innermost lining of the intestine. Okay, so it doesn't penetrate through the entire bowel wall. That's hard to say together. Crohn's disease, about 67% of people in remission will have at least one relapse over the next 5 years, which, I think that we can have a little bit of say-so in how that happens. Ulcerative colitis, about 30% of people in remission will experience a relapse in the next year. Both of these are considered autoimmune diseases. Both of these are highly correlated with eating inflammatory foods like gluten and soy and dairy and sugar and things that don't work for the body most of the time, that we cannot process, we cannot break down. Understanding these diseases in completion is not necessary as a health coach. You don't even need to know everything I just told you just now. You just need to know that it's an autoimmune disease, just like any other autoimmune disease, like rheumatoid arthritis goes after the joints, thyroid goes after the thyroid. There's hundreds of autoimmune diseases. These get a lot of attention because they're related to the bowels. They're related to constipation, diarrhea, symptoms that are very visible. With thyroid, as many of you know, you could be walking around with it for years and not know it. With these are one of those things I think that are more pronounced. And so linking back further to the Crohn's and ulcerative colitis, keeping in mind that when something happens in the gut, many times it happens in the skin, as did happen with my Crohn's disease girl who had the rosacea so badly her face was just nothing but bright red. And so anyway, what I want to say about this is that when we work with people with these problems, it's just like working with anybody with anything else, as far as what we're approaching them with their whole food, with getting their sleep under control, helping them understand stress. All of that stuff applies to this. The only difference is that these can be a little bit more urgent. So, for example, when my friend with the ulcerative colitis was having bloody stools and diarrhea and losing weight severely, no one told her she had ulcerative colitis until she actually ended up hospitalized and almost lost her part of her colon. So she asked for a last, ditch effort to fix the problem. Please let me go home. Let me try to figure this out on my own. And they did, and that's when we found each other, which is miraculous. That happened within a couple of weeks of each other. So just the fact that these can cause, such severe symptoms that can, that can significantly affect somebody's quality of life, and can even be fatal, makes these a little bit more urgent than some of these other ones that we're looking at and dealing with. So specific questions about Crohn's disease, and I'm going to copy this link and I'm going to share it. Because, the causes of these diseases are just like anything else. We're looking at toxins that are coming into our mouths, coming in through our skin, the environment, stress, parasites, pathogens, you name it. That's all autoimmunity is coming from all of these different things. That's why it's really important that we come at these problems our clients are having with a full scope approach, the entire, head to toe approach. It's never just enough to take out gluten to help someone with a bowel problem. It's never just enough to work on stress so that they can increase their stomach acid. Makes no sense to work on stress, right? And on perception of stress, reducing stress, however you want to call it, if they're going to continue to eat something that's going to affect the stomach acid anyway. So, it's just, I don't know. Just one of those things I wanted to bring up in the difference between the two, because they are different, but many times when I'll ask someone, they'll say to me that they have IBD, and I'm like, okay, well, what problem do you have? Crohn's or colitis? I don't know which. And I'm like, oh, okay. Well, it's important to know which because they're different. So, all right, let me pop onto Facebook real quick and paste this link in for you guys so you can see exactly where I just was. Hi, Bernadette. Thank you. Thank you for your kind words about my little guy. You guys have been so awesome. Okay, so then the other thing I wanted to ask, now Merle, I think, was the one that had the question about Crohn's, if I'm not mistaken. And she said she might not be able to get on here. Does anybody else have questions about Crohn's or anything about autoimmunity or how to deal with these things? Or I think it's becoming very clear to you guys that I think I treat everything exactly the same. Some things are more urgent than others. Some things have to have specific things taken out. So let me just say, like a rheumatoid arthritis, someone comes to you with rheumatoid arthritis, someone comes to you with diabetes. Both autoimmune, both require a whole food overhaul. Both need to be approached with a reaction to, whether or not the client is feeling stressed out about what you're suggesting to them. All of these things have to be taken into consideration. But the person with rheumatoid arthritis, once we've gotten into the introduction of whole food and stress and sleep, might take nightshades out, okay? Then your other person over here with diabetes might go on a ketogenic diet, whichever. But that's where the customization comes in. So with Crohn's and ulcerative colitis, you would more than likely and probably take out gluten with both of them. More than likely and probably take out soy and dairy and all those things a little bit at a time. The only difference is you might look into some supplements for helping them to repair specific pieces of the intestines or the colon, right? So I don't remember exactly what slippery elm is, which one it's good for, or marshmallow root, but there's differences between the two. And so when I worked with my girls, they were taking different supplements to go after different pieces of the healing process and the repair. Of course, I don't say healing with them, but, and I gave them the links for it. And even with my friend, the vet, I gave her the information. She's very, very smart. Obviously, she's a vet. She took everything to her doctor at Vanderbilt, told her what she was going to do. The doctor said, I don't approve of this. I think you need to do the Humira, which is an immunosuppressive drug, which is absolutely horrible on the body. It's horrible to administer the shot. Her shot was $1,000 a piece. She cried every time she did it. It made her violently ill. And so she did it for just to appease the doctor. and then was like, I can't do this anymore. And when she went off of the Humira, allowed her immune system to pick up the slack and start working like it was supposed to with all of the changes we made, that's when the remission went into place. So anyway, so her doctor even said, I don't know what you're doing, but keep doing it and just, keep me posted on how you are. So here's the other thing about autoimmunity I want to throw out to you guys. Let me see if I can backtrack. It was probably what year are we in? 2017? Oh my gosh, 2011? Maybe earlier than that, maybe 2011, 2010. I came upon a drug called naltrexone. So it's low dose naltrexone, LDN. You guys are probably starting to see a lot of it in the functional wellness space right now. But back in those days, I actually got all the information. I kind of tapped into some people under the radar, ordered some of this stuff from another pharmacy that was not, I'm not going to say it was illegal, but it's not the usual route that you go to get medications and stuff like that. I called several pharmacies around the country, did some interviewing about the low-dose naltrexone and what it does to the body. And I think that it is extremely powerful to use with people with autoimmunity. I know that there can be, it's relatively like low or no side effects whatsoever. So if you know people that are dealing with autoimmunity, or if you are, it's a suggestion to share with people as a modality that will enhance their own repair and healing process. So let me tell you what low-dose naltrexone is if you haven't heard of it yet. It is an opioid antagonist. In other words, it blocks the opioid receptors in your brain. I'm going to read this from this page, and I'm going to share this link with you guys. These receptors are meant to respond to endorphins. These are your body's natural feel-good chemicals. So opioids, including the ones in prescription pain medications, Percocet, Dilaudid, Lortab, Vicodin, and other drugs such as heroin, attach to these receptors and produce a similar result. They block pain, slow breathing, produce generally calming and antidepressing effect. As an opioid blocker, naltrexone prevents opioids from attaching to your receptors and producing this result. So in the 80s is when they started using just full dose naltrexone for opioid addiction, because taken at the higher doses, it really prevents patients from experiencing the high of opioid drugs. So the downside of it is that it also blocks the happiness and the high from other things as well. So anyway, there, Dr. Behar, I think it was Behar, B-E-H-A-R, Bihari, let me scroll down and see if she talks about him. Okay. Yes. Okay, here it is. So I'll just read it to you. While naltrexone is still used primarily for opioid addiction, at the time it was introduced, a doctor in New York, Dr. Bernard Bihari, that was close, discovered that it was beneficial for results for patients with autoimmunity, cancer, AIDS, and HIV when taken at a much lower dose, around like 4 milligrams. So when I just told you guys 50 milligrams for addiction and all of that, 4 milligrams for helping people with autoimmunity. What happens in the low dose, hence the name low dose naltrexone, LDN, the lower dose actually increases the level of endorphins in your body by only partially blocking those opioid receptors briefly, when your endorphin levels are typically highest around 3 or 4 o'clock in the morning. This signals to your brain that your levels are low, so it ramps up the production of endorphins, increasing your overall levels. Now, why is this beneficial for autoimmunity? Because endorphins play a huge role in immune system modulation. Autoimmune patients, cancer patients typically have lower levels of endorphins than people without autoimmunity or cancer. So just keeping that in mind, if you're a person with autoimmunity, you may have lower levels of endorphins. I know that to be true for myself, because when I used to do extreme workouts, I never really got that rush. I was never that person that would go running and feel that high, that runner's high. That's kind of when I started looking into the LDN. I was like, this really kind of makes sense for me. So no one knows exactly how endorphins modulate the immune system or why they're decreased in autoimmune patients, but studies have shown anti-inflammatory benefits, a decrease in Crohn's, multiple sclerosis, fibromyalgia symptoms in people treated with LDN. Tons and tons of research out there. I mean, when I was researching this stuff, and it's good for, just about any autoimmune disease, Crohn's, celiac, ulcerative colitis, multiple sclerosis. My vet friend is taking LDN. My other girl with Crohn's, she talked to her doctor about it and they weren't up for it, but she did very well anyway. And I'm not sure if she ever started it, but it is something that I sent a link for. It is something that I suggested to them. And now the doctor at Vanderbilt, actually, she suggests it for her clients and her patients. So I thought that was pretty cool that my vet took information that I gave to her and educated a doctor at Vanderbilt. So that's awesome, you guys. This is what I'm talking about when we safely share resources, and you know, things that we know can be helpful to people, and they take it to a doctor, we're making such a bigger impact than just with that one particular client. We're really making a difference in that doctor is making a difference in other people's lives. Who knows if those people are suffering with some sort of a other autoimmunity. They're talking to people in their groups, in their forums. Like, don't think that sharing resources makes you not a better health coach. It makes you a better health coach. It makes you, you know, more empowered to share information with others and spread the word. Because that's what this is about. This is not about hoarding people that are sick to keep to yourself to have a successful business. This is about making a difference in a really big way, right? Okay, so let me go to Facebook real quick. Stan said, found you. Huh, was I lost? Oh gosh, I probably have been lost here the last couple of days. Kathy said, would you suggest trying to raise your endorphins with supplements prior to taking LDN? Not necessarily. You know, it's a good test if you are a person that exercises. If you're not a person that exercises, you can do some of that high intense activity and see if you get that rush, that endorphin rush. But I don't know. Let me say this. If you want to try a supplement to see if it would help, fine, but I don't think it's necessary prior to taking LDN. LDN is so, I'm going to grab another link for you guys too, the original link that I went exploring on when I started this whole process years ago. Hold on, I get a minute. I just jumped right into it. I didn't do anything but kind of titrate up a little bit. I did the titration because I'd heard that if you don't, you know, you can have some pretty good nightmares, which that is the only side effect that I had, is I had vicious nightmares. Super scary. Freddy Krueger. God, I mean, like, I cannot tell you, nightmares. And I remember all of my dreams. My dreams are like real life to me. Sometimes when I wake up, I'm confused about where I was because of how real my dreams are. So when I had nightmares from the low-dose naltrexone, I really went back and backed it down even further. And it only lasted for like 3 days, and then they went away. So that's just something I think everyone should be prepared for, because it's really the only side effect that I had. Okay. Any questions about LDN or any of that stuff? Anything you guys want to ask me about, personal experience, anything. I just think it's an awesome thing to consider. I think it's something that you guys should know more about. I think you should learn more about than LDN, the naltrexone for autoimmunity. And you don't have to learn everything about it. Just remember, like, if it's something that resonates for you as a coach or you as a person that might be beneficial, then it might be something that you might suggest to your clients. It'd be super helpful. Okay. All right. So that's my deal on the Crohn's, touching on bringing in the ulcerative colitis, bringing in other autoimmunity, and then wanting to bring the blah, 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 LDN to you guys today. Can you tell I haven't slept in 2 weeks? Yeah. So, okay, let me go over here. And I know Anita, if you're on here still, would you just give me a hi or a post somewhere and let me know that you're still on, so that I can make sure that I talk about the things that you want to talk about. Okay, if I remember correctly, now I can't scoot around on this page because I'm afraid I'm going to lose you, but I am going to open another window. So hold on a second, you guys. I think we were talking about diabetes, and we were talking about lead, right? Like you wanted to know about detoxing lead. Is that right? Tell me if I'm right or wrong there. Hey, okay, I see you're here. Okay, hold on just a second. And then I'm going to scroll through a couple of other things too. So hold on just a second, you guys. Boy, we can seriously do some talking, which I love. I love it. But I got to scroll to find my posts and, you know, get the question. Hold on a second. Where did it go? All right. I don't know where it went. But Anita, am I on track? Diabetes and lead, right? Okay. Okay, so the client with diabetes, and I think if I remember correctly, you said she is holistically minded, is doing gluten-free, dairy-free, all of that. Is that correct? I think that, let me know if that's correct. Okay, so the first thing I want to say is this. Chris Kresser put out an article today. I got in my email. Okay, you said yes. All right. And it's talking about type 1 diabetes being potentially reversible. So I want you, if you haven't seen it, Anita, I will grab the link and post it in here for you guys. Tell me if you have it or haven't. I'll grab it for you and pin it here. That is something that I would definitely share with her and send to her. The other thing is this, is as far as the lead is concerned, do you know how she was diagnosed with it? Did she have a hair mineral analysis test, all of that kind of stuff? How did she get diagnosed with high lead? And I'll wait for your answer there too. And then I see Gabriella's question about the prescription question for LDN. Yes, you need a prescription. It's not as hard to get as you may think. Shannon Garrett, actually, I interviewed her for you guys. If you guys remember, actually that was last fall for the students of the Health Coaching with Confidence. But I interviewed her, and she has a contact that she's given to me that can help with LDN for people with autoimmunity. So if that's something you're interested in, let me know, and I will get you guys the link for that. You don't think it was hair analysis? Okay, so I would find out really how she was tested, and because here's the thing, you know, I mean, blood testing, saliva testing, hair mineral analysis testing, urine testing. We've got all these tests. And then we have all of these opinions, you know, about, you know, what's more valid, what's this, what's that. And I've had people tell me hair mineral analysis is a joke. I've had it done. I did that probably 6-7 years ago. Then I've had people tell me that you have to test your blood for lead, and I've had that done. I really don't know the answer. To be honest, I don't have the answer on the best testing for lead. If I put this out to the Mindshare community and ask them, there's going to be several different people that have different ideas there too. Hair mineral analysis is the first place that most people look for this type of thing. So I might look at that and tell her, so if you're not working together, if you do run into her again, that would be something I would suggest is, you know what, I might get a hair mineral analysis test done before I would diagnose myself as having too much lead. And the reason for that is because, you know, one of the things we can do, let me use copper as an example. Is it copper and zinc? Let me use those two as an example. So let's say someone goes and gets tested and they're told by a doctor their blood is high in copper, their hair shows high copper, whatever it is that they get tested in, okay? And the person says, okay, my copper's high, I need to take zinc to counteract the high copper. They start taking the zinc, and they weren't high copper after all, and the next thing you know, they've got too much zinc. There's a fine balance with minerals. There is a reason why, you know, that we need to be absolutely sure of what's going on with this kind of thing. It's the same thing with iodine and selenium. So someone who is low in selenium and starts, you know, supplementing with iodine may have problems with iodine. They may have their Hashimoto's may flare up or something like that. Selenium is important. It's they work together, not counteractive, but I mean, it's a partner to iodine. So when someone says, oh, you're high in lead, you should take this particular supplement, it'll get rid of it, it makes me a little bit nervous unless that person is super skilled in that kind of thing. So yeah, so I'm glad you suggested hair analysis. I mean, I'm not 100% sold on it, but it's good to have a couple of different tests to see if that's really truly what's going on. So I posted the type 1 diabetes link down there. If you talk to her again, I would share that with her. Karen is asking, is there another way to view this? I can't get live feed to operate for Facebook. I'm recording this, Karen, so I will plug it into the Health Coach Mentorship and Mastery for you guys. Okay, and then I wanted to mention this too. She shouldn't try to watch sugar and gluten. She should be watching sugar and gluten, period, if she has diabetes, 100%. You can't just, let me just push this home again. I know there's some of you that are like, enough with the gluten already, Carmen, but it's either you are or you aren't gluten-free. You are not pregnant or maybe you're pregnant. You are either pregnant or you're not. Same thing with gluten. You either eat it or you don't. One tiny crumb, if you're going to eat a bite of a piece of cake and say, well, I don't eat that much gluten, I just had a bite of cake, you might as well eat the whole cake. Just eat the cake. I mean, if that is the way that people are going to be about the gluten, then they just need to eat it. And I told my husband the same thing. He's like, well, I only eat it when I'm not with you. This was several years ago. And I'm like, just eat it all the time then. I mean, it doesn't matter because it is that inflammatory. The body doesn't say, oh, that was just a bite of cake. The body says that was gluten. The body doesn't say that was just a bite of the pizza. The body says that was gluten. So when we talk to our clients about this kind of stuff, you know, there is a way to approach it. I'm only saying it kind of harshly because you guys get it. You get it. But when we're talking to our clients, we need to make sure they understand this idea, this thought process. And I like to use the pregnancy thing if you want. I mean, whatever you have to do to get it through to people that gluten is inflammatory. It is not good for people with autoimmunity. It is horrible for people with any kind of digestive disorder or anyone that's not sleeping well, anyone that's depressed, anyone that has inflammation in their body, whatever. Gluten is toxic, period. It's a man-made protein. I just don't agree with eating it. I mean, you agree with me or not agree with me, doesn't matter. But if you're working with people with serious problems, that's the way to say it. Yeah, So just tell them that. Say, with gluten, it's like being pregnant. You either eat it or you either are or you aren't pregnant. You either eat it or you don't. Don't back off of it and say that that's good enough. Now, use the titration down from it. Sure, like tell her, 1 week take out this, 1 week take out that, the next week take out that, and then in a month or 2 months or 3 months, you'll be gluten-free. Do it however you have to, but just know that the end result is complete zero tolerance of eating it, okay? All right, so there was something in the, let me see something here. There was a comment in the events section. I'm looking right now, and I can't remember what it was. I'm going to look for it. Looking. And the reason I'm down here doing recordings is because my little guy is gone, and he used to be the one that would yelp and cry during my webinars and stuff. And so I'd have to go to a totally different room, and now it's awful quiet around here without him, so I'm able to sit at my normal office. Okay. All right. Okay, Robin. She said, I think we also need to hit on how to deal with being more aware of providing context to our clients on the dangers of environmental toxins, as this can impact the health in a big way, as well as derail other health efforts. Yes, and Kathy posted there that I did an interview with Laura Adler a few months ago talking about toxins. Here's the other thing. Laura is actually doing training for my institute, so I'm super excited about that. She is going to do a toxins training 101 for health coaches that attend the institute. Now, what I probably will ask if we can do is to do, if she would be willing to do a mini training and offer it as a kind of a, something you guys can purchase through the Institute as a freestanding program if you want, that you don't have to take the entire course. I need to make a note on that so that you can benefit from it. But I also have an affiliate link, and I think she gave my coaches a discount that are in the mentorship group. I can't remember. But if you're interested in more training and you want to know if there's a discount or a link to Laura, let me know. But I agree with you. So the environmental toxins thing is not part of the 7 foundations because let me back up. The 7 foundations of health that I follow, environmental toxins fall under stress for me. They also fall under food. Okay. They also fall under, exercise. They fall under everything. Environmental toxins and the things that come into our skin, into our mouths, into our minds, fall into that 7 patterns of, that are the 7 foundations of health that I talk about. So I truly believe that I 100% agree with you, Robin. I cleaned up my own act around here, 7 years ago. I don't remember. But I literally took a garbage can. I went into my bathroom and I put all the things I thought were safe. It's kind of like how I suggest you guys help your clients clean out the pantry and the fridge. One side of the counter is safe. One side of the counter is unsafe. This is education, okay? This is basic ABCs of cleaning out the pantry. Put out all the things you think are safe from the pantry. Olives, coconut aminos, tuna, that's wild caught, whatever. And then unsafe, you do this. So that's how I help my clients clean out their pantry. Well, I did the same thing with my bathroom stuff. When I got done kind of doing my own little education in my bathroom, I pulled my phone up, got my ewg.org, or was it my computer? Probably my computer. ewg.org, pulled it up and started putting in the things that I thought were safe. Some of my Burt's Bees stuff. Threw everything away. I didn't have one safe thing in my cosmetics, not one safe thing in my lotions, none of my hair stuff, none of it. I couldn't believe it. I was like, it said organic, all natural, Burt's Bees. All of it had something toxic in it. So it all went in the trash. A little bit at a time. I kept some of it, but just to get by and start replacing things with natural stuff. Did the same thing with my cleaning supplies. Did the same thing with my yard sprays, my bug sprays, my laundry detergents, all of that stuff. So I think that it's not enough to just throw it away and think you know how to replace it. I think it truly is an education, and I agree with you. Now, you can do it on your own with your clients by doing what I just said. Give them create a handout for them and have them create the unsafe and safe piles in all places of their home. But then they're going to have to be prepared to do the work on what is and what isn't going to be thrown away, because this is not cheap. This is not a cheap way to clean out your house, okay? Because that stuff's expensive. I threw away makeup that was, $15, $16 a thing, or mascara that was, $12, and I had to replace it with even more expensive stuff. So the ultimate goal with all of the things that we do and suggest with our clients is low stress. That's why on the intake form it says, rate these things from high stress to low stress, 1 through 7. Tell me which one's the easiest to consider changing, and let's start there. It is about the client. It's not about what we think. It's not about what what we think is best for them. It's about where they are and where do they want to go and how do they want to get there, and there we are to support them. Okay, what do I use for laundry detergent? I make my laundry detergent most of the time, Deb. I have the Dr. Bronner's? I always forget. But I shave the bars down, right, on a grater, and then I combine it with the baking soda and then the borax, and I do a shake it all in a big container. Now, if I am just too lazy to do that, I do the Ecover, E-C-O-V-E-R, detergent and softeners sometimes. Sometimes if I'm super lazy and I don't get a Vitacost order placed, I'll get the 7th generation, free of this and that and whatever. So that's what I do for that. And then you can use vinegar too for the softener. I want my clothes to smell good. And I know that's crazy because they say that when things smell good, that's part of the toxins. So since my dog ate the wool balls that I used to put my essential oils on in the dryer, I haven't gotten any more because she's so sneaky. She goes in there and she pulls them out and eats them, or she goes in a laundry basket and she eats them. So now I do like to use the Ecover fabric softener. Sometimes I will throw a washcloth with some essential oils on it into the dryer. So that's kind of how I roll with that. Stan says, I found out I'm gluten sensitive and was told by multiple doctors never eat it again. You can undo 6 months of good work with one cheat. Amen to that. Yes, I think everyone's gluten sensitive. So even if, or gluten intolerant, gluten sensitive, whatever it may be, I think everyone reacts. And let me just throw that out there. 6 months to a year is how long it takes to reduce inflammation in the body in someone with just general, maybe just some general health problems or autoimmunity. 6 months to a year is not worth it to me. Robin says, what are you using for your cookware, steel or glass? I use ceramic, I use stainless, and I use cast iron. Gabriella says, Bonami is good for scrubbing or pure baking soda. Yeah, for glass vinegar, yeah. I was talking about putting the vinegar in the softener container in the dishwasher. In the clothes washer, because that's supposed to soften your clothes, but it stinks. So, it doesn't make my clothes stink, but I just don't like it. Okay, let me see here. Is there anything else that we needed to touch on or talk about today? I've got a few more minutes before I have to meet somebody. So did you guys have any questions about anything else? Anything that you feel you need for training or for working with clients or any of that? Anything at all? Hold on a second. Somebody just popped in with a message here. Let me see if it's related to this. Oh, nope. Okay. All right, so Gabriella said that she got Shannon Garrett's, you did get Shannon Garrett's LDN guide, right? Gabriella, you're talking about Shannon Garrett, right? Yeah, so I think that's it. It's amazing. I really think it's pretty impressive, I have to tell you, because I've had people start on the LDN that have reduced their thyroid medication by almost half. Some people that have gone off completely and gone on to a natural supplement for thyroid. So it can be really, really good. It can be really powerful. I went off of it for a while because let me tell you how powerful it is. Okay, this will give you a general idea, and I'll tell you this is why I went off of it. Because I got strep throat in 2014, I think it was. I got strep throat. And I had not been sick, in forever. And I thought, well, whatever this is going on, I'll just, bone broth it and vitamin C and glutathione and sweat it out and all of that. Well, I felt great after about 2 days. I felt great. Throat didn't hurt. Body didn't hurt. Felt fabulous. Could have just went right back to life, but I could not shake a fever. I had a fever of 102 for 5 straight days. I think it was 5 days. I couldn't break it. I couldn't shake it. Nothing I did made me feel better. I was sweating through everything. So I went in and got a mono test, and I was negative for mono. Went home and I'm like, what in the world could be causing this fever, like this unbelievable hotness? I stopped using the LDN and the thyroid medicine just for the day. I thought, I'm just going to stop. If this is overstimulating me, I'm going to stop. Completely gone. Fever gone. Temperature back to 98.6. It had overstimulated my immune system. The LDN had stimulated my immune system so much that it was like I could not stop it. I don't know how to explain this. I'm not sure if it's in the thyroid guide or not, Kathy, because I wrote the guide a long time ago. It needs to be added if it's not in there. I'm not sure. I'll look at it and tell you. But anyway, I'll add it in there and I'll give you guys an upload on it if it's not there. But anyway, so just to let you know that the LDN was overstimulating me and it was terrible. I just stopped it completely and I never ended up going back on it because I almost had this like fear that I was going to have that happen all over again. And then I forgot about it, to be honest with you. I went from 80 micrograms of T4, 50 micrograms of T3 down to 25 micrograms of T4. And that's all I take today. So should I take it again? Maybe. Could I reduce my thyroid medicine even further? Possibly. But I feel pretty good right now. So I'm just kind of sitting where I am. It doesn't mean that I'm not going to do it again. It just means that for me, I'm okay with where I am. And when I have, when people have a lot of stress and they have things going on, it's best not to rock the boat sometimes. All right, Regina says that I found beef and pork cause me body pain. If I take collagen or bone broth, will it do the same thing? I don't know. It shouldn't, but eating beef and pork. So the difference between the actual eating the whole meat, you're getting, I'm assuming, Regina, that you're eating humanely raised, grass-fed products with no antibiotics, no blah, 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 right? That's my guess. Anyway, that's what I would guess. But, there's so much more than just the collagen that comes, in the bones of these animals that can cause problems. It could be anything from, what are they eating? I mean, what kind of, if they're not 100%, okay, so if they are humanely raised. So, I don't know why they would cause you problems. To be honest, it might be a histamine issue. I've heard that people that have problems with beef and pork can have histamine problems. Doesn't mean that collagen won't bother you too, but I would start with a teaspoon of the collagen, but bone broth more than likely would probably cause the same problems as far as histamine is concerned. Someone else tell me if I'm wrong here, but I think histamine is exacerbated by bone broth. So I'm not sure. It's a good question. I can do some looking on that for you if you want me to. Let me know in the comments if you're interested in me pulling something up for you, and I'll see what I can find. All right. Stan said gluten protein stay with you for 2 years. Yeah. Ugh, yuck. It's just not worth it. Jody Cohen's Vibrant Blue Oils. You might add that too. I don't know if you're talking to me or not, but yeah, I already used them. I met her last year at Mindshare, and she gave me like a beautiful sample of stuff, and I used the thyroid accelerator and the parasympathetic oil I love. It smells like Coca-Cola though. Did you know that, this is just a little tidbit, lime oil and clove oil mixed together smell like Coca-Cola? Okay. Lizette says, different question. I'm guessing Botox injections are a no-go for everyone in your opinion, right? Correct. Yep. Actually, let me tell you a little story about Botox. I have stories on everything. When you work with so many clients, you guys, just the stories that you are going to be hearing and running into will blow you away. So a very high profile person in our community hired me, and because she had Hashimoto's autoimmunity, I used to train her, and she wanted to do the health coaching stuff because she ended up getting getting her injections in her skin. Okay, so it's all about how you look and stuff. She's a beautiful woman anyway, but she was trying to amp it up a little bit when she entered this whole high profile position as a wife, and she ended up with, I don't know what they were called, not lipomas. That's what they look like though, like little things under her skin where her skin, she like had an autoimmune reaction to these injections over time, and it developed these pockets of fat, and they were pushing out of her skin. She literally was starting to look deformed. Horrible. I mean, horrible. I can't even imagine going through that. And it was from injections, Botox and another kind of injection as well. So do I think people should be putting stuff under their skin? No. Do I wish that I could get rid of this, number 11, and these, and this? Yeah. Do I wish I hadn't smoked for all those years that I did and this? Yes. But you know what? Our face carries our story. And so I just don't believe in it. So anyway, Regina, I look up on that comment. Bernadette says Lone Star ticks have been causing meat allergies up here. I mean, that is a high possibility that could be causing you some problems. Are you for sure that it's the meat that's causing you pain right now? Are you in pain right now and it's because of the food you just ate? Like, can you trace it back? So remember this, you guys. Food intolerances, allergies, and reactions take about 72 hours. So if you ate a piece of steak on Wednesday, yes, you absolutely could be in pain today, because I don't think the 72 hours has passed. I'm terrible with math. But if you ate bacon on Wednesday and you're still in pain, it is possible that that's where this is coming from. Absolutely. If you were in pain, and I'm assuming this is musculoskeletal myalgias, things like that, maybe some bone pain, whatever is going on there, what I would probably do is I would start my day fresh. I would wake up. I would have absolutely nothing but maybe some warm lemon water or warm water. I would start with very, very bland, basic stuff. So, you know, don't even do eggs because eggs can cause that. Like the white protein of an egg can cause that problem. Hey, are you home? Yeah. Okay, that's fine. I'm doing a live webinar, so people are listening. But so anyway, I would start from scratch with that, and then you know, take it slow. Start with some wilted greens. Do some ghee. Don't do any butter. Like, just try to avoid all your general standard high inflammatory products. Is that seriously bread? Let me see that. Let me show you guys something.
Never even eaten any of it.
Oh my gosh. Okay, so can you guys see this? Give me a message if you can see it. Do you see the mold? Is that disgusting? Okay, so this is gluten-free, plant-based, egg-free, non-GMO, vegan bread that we literally have never eaten, and it is moldy. That's disappointing. Okay, anyway, back to the board because I got to get out of here in a few minutes. Let me see. But Regina, let's try to hack away at that a little bit and see what's going on with you. Come to the group and let us know if we can help you. But I would start absolutely 100%, possibly thinking about taking out all of those high allergen foods. Think about what Bernadette says there on the Lone Star ticks. Consider doing some looking into the charcoal to carry out whatever toxins are happening there, and keep us posted. Rebecca says, what kind of cosmetics do you use or suggest? I just got my beauty counter stuff. I'm signing on with them. Yes, it's a multi-level marketing thing. I'm going to do a whole post on that. But I've got, you know, it's been coming at me for a couple of years from some of my really, really picky friends about multi-level marketing, and seems to be one of the best products out there. So I will keep you guys posted on that. I haven't started using them yet, but you can look at Tarte, T-A-R-T-E is a good brand. That's what I use for all of my solid bases, my eyeshadows, mascara, all of that kind of stuff. And then you can also go out to ewg.org, and they have a makeup and a cosmetics guide out there, and Vitacost carries a ton. So if you go to Vitacost, you can shop on the left-hand side. You can check things off that you don't want in your makeup, and then you're going to get some suggestions there as well. Gabriella is it Gabrielle or Gabriella? I have a lipstick by her. She makes some good stuff too. Okay, let's see here. Deborah, I agree. Our face is our story. Thank you for saying that. Absolutely. Of course. Gabriella says, I cannot have rice anymore. Oh, why can you not have rice, Gabriella? Does the grains bother you? Are you eating a low arsenic rice like Lundberg? Let's see here. Deb says, my face has quite a story. So does mine. I hear you. Okay. Oh, it gives you swollen hands. Oh, that's interesting. What brand are you using? Stan says, I freeze gluten, non-GMO bagels, must take out the night before and toast. I hear you. Yeah, usually we keep it in the fridge, but I just bought this and it didn't even have a, what's the date today? It's literally it was by the 11th, and it is the 14th, and it's already molded. I guess the squirrels get some of that today. Okay, I have the beauty counter even from Laura Adler. Yeah, and that's Rebecca said that yeah. So that's what I'm telling you. That's why I'm signing on with them, because if Laura suggests it, then I know it's safe, because she's the environmental toxin Nazi for sure. So Gabriella, take a look at what kind of rice you're eating. It's possible that it could be a higher arsenic rice that's causing the problem. Rice cakes and next day. Okay, so Lundberg is the lowest arsenic that I have seen out there, if I can remember. It's been a few months since I've looked into it. But maybe look at that if you really want to eat rice. I mean, if you really want to add it in. I can't see. It's the most benign grain there is. I just can't imagine why it would cause that problem. Now, rice cakes aren't always just rice. So see if there was another filler in the rice cakes and see, yeah. So what else is in the rice cakes? Because, you know, they're not just rice. There's usually some sort of a puffed, something is in there that holds them together or whatever. So look outside the main ingredient and see if that could be causing the problem. Okay. All right. I think that's it for today, you guys. I have an appointment to be at shortly, and it's Friday, so cut out early and enjoy the rest of your day. As always, I love that you guys hop on and have conversation with me, and any questions you have, put them on the board and I'll answer everything you've got. And just don't forget, a couple of reminders, you guys. We have training coming up. Hold on a minute. Let's see, we have Kylie. Oh my gosh. Okay, Monday is Kylie. So if you guys have seen that coming around, she's going to be doing all of this tech training, and she is from Health Coach Help. And she is also doing training for the Institute as well. She's creating a training just for you guys. And then we have the Truth Series on Tuesday at 12 o'clock. And then we have Taylor next Friday. And I'm going to post some great stuff about Taylor. She has, Taylor and Allison have gone like haywire with their changes. I'm super excited for them. Some really good things happening. And so I will share that stuff with you guys when I get back on the computer. All right. Love you guys too. Love you too, Kathy. Have a great rest of the day. And thanks again. See you later. Bye.